So we're here today with Dr. Burhan Kassim from Southside Dental Implants here in Brisbane, Sunnybank. And today we're going to be having a bit of a chat about dental implants and some of the pressing issues around this type of dental treatment. Thanks so much, Burhan, for being with us today.
Hi Jess, it's a pleasure to be with you today.
So, Burhan, why don't you just first off explain a little bit for our viewers about dental implants and how they work?
Sure. Well, what a dental implant is essentially a titanium screw that's inserted into the jawbone. So obviously they're used to replace missing teeth. This here is an example of a screw. It's just basically a screw, and it's inserted into the jawbone like so, and then it is used to replace teeth. So you don't need one implant per tooth missing, but it is used to anchor prosthetic teeth in the situation where someone's lost their teeth, basically. So right. that's what they are, and that's what they're used for. Yeah.
Now, there has been a growing trend toward people going overseas for treatment for a lot of dental procedures, and particularly dental implants. Is this something that you've found or experienced in your practice?
Look, I have, Jess, to be honest. It's something that I think people are doing more and more, and I understand the reasons behind it. I really do. It's concerning to me to some extent because I see increasingly more problems and complications. And let me just say, Jess, that I'm not saying that complications don't occur if you have this treatment done in Australia. There are good Australian dentists, and there are not so good Australian dentists, and there are good overseas dentists, and likewise there are not so good overseas dentists. But I guess inevitably, surgery being surgery, there are things that can happen, and there are things that can go wrong, and there are certain protections that you have when you have surgery done in Australia. So I guess it's frustrating as a clinician. We have a dental implant practice, as you know, and when we're faced with complications from treatment done overseas, it's frustrating to be in that situation when you're talking to a dentist overseas, often in a foreign language, trying to ascertain what treatment has been delivered so we can then work out a solution. So I just think it's nice for people to be informed about the pros and cons. I'm not here to convince anyone to do one way or the other, but if they understand the pitfalls, the potential pitfalls, and so be it. I wish them all the best. Yeah.
So I guess the biggest discussion point is most likely always about cost and how people can save on dental implants. And I guess that's sort of the reason why people are seeking this treatment overseas. What would you say, in terms of cost-wise? Because I've looked myself, and I know that it varies greatly here in Australia and overseas.
Sure.
What's your take on that?
Look, it does vary, Jess, but I've looked into that myself because I think a large proportion of online inquiries are centralised around the dental implant cost here versus overseas. So I've done a little bit of investigation in that myself out of interest, and the variation overseas is immense. They vary from $250 from in India, and I also came up to there's companies in Australia that outsource, and they're almost like travel operators and
like an agency.
Like an agency, and I looked at the potential cost for having an implant through there, and it was pretty close to local prices. So it varies hugely. But at the end of the day, you're right. I mean, it's cost.
Yeah.
That's why people elect to go overseas, because it's a cost saving. And I do understand that. I do understand that. But whenever I've done the exercise, I've always found that to be not that great a benefit. When you look at airfares, I should say.
Yeah, what are the costs involved with going overseas for dental?
Well, I guess there's the airfares, there's the accommodation, and the way around that, the justification for that I hear, because I've had this conversation with many about having a holiday at the same time. But I don't know about you, Jess, but if I was having surgery, I would rather be around my family and friends rather than in some foreign place. And I tell you what, I wouldn't be wanting to do any sightseeing probably. I just want to be taking it easy.
Yeah, definitely.
Yeah.
So what has been your experience? You know, have you treated people that have had dental implant work overseas? Like what would you say is the percentage rate of successful implants done overseas?
Look, I guess that's a very good question, and I think the problem with me and knowing an accurate answer to that question is unfortunately I see all the stuff gone wrong. Because likely when something's wrong, that's when they Google me and find out my name, and I do my best to help them. That lies another problem. If you have work done overseas, trying to find a local clinician to help you in your situation, and that is difficult because there's a lot of work involved in trying to find out exactly what implant system has been used on the patient so that you can then figure out a solution. So that is one of the advice that I would give to somebody that did decide to go overseas. I have several things that I really believe that they should look into before they go to make things a little bit easier in the future.
So what would be those things if say I was to start looking overseas for an option? What would be some of the things to avoid? Or
sure. Look, I think it is difficult, but I think to find a suitably qualified person, that is hard, you know. It's funny, sometimes people judge a clinic by the lavishness of the waiting room, you know, and I don't think that's a good indication of how good a surgeon he or she is. I think that, number one, the most important thing is to make sure whatever dental implant system they're using is a locally available brand.
Yeah.
Because the analogy that I use, it's like a car. If you import a car, through wear and tear, inevitably there's going to be some maintenance needed on that. Okay? So you need somebody with a sufficient skill set to fix the problem, but you also need that person with access to certain parts and materials. Okay, it's the same thing with the dental implant. So if the system is locally available, then that is a positive from the start, because you have that access to spare parts, because it is a mechanical system. I mean, a dental implant, really, it's like a little mechano set.
Yeah.
You know, there's a little screw that fits into another screw, and there's just wear and tear that occurs because the jaw muscle can generate an immense amount of pressure. So I think the first thing, not only get the brand of the implant system, but all of these materials come with little stickers in the packaging. So I think request to get the actual sticker with the lot number. And the batch number and all of that information, as well as the brand. Okay? Because sometimes they may say that you're getting a particular brand, but it's not a Straumann implant, for example, but it's a Straumann compatible implant. So I would get the brand of the implant as well as the specific information from the packaging. And I would extend that as well for the bone grafting materials that they use, because most of these cases do require some form of bone grafting.
For the more complex dental implant?
Yes, but in saying that, I would say 70 to 80% of cases need some form of bone grafting, albeit minor, but you're right. That will be one of the things in addition to the implant to look into.
Okay, so just with the actual procedure, how long does it take, say, if you did need a bone graft, from the time a patient goes in for their consultation until they have the final finished tooth that they can use? How long is that?
Sure.
Period?
Well, look, in the most common circumstance, in an ideal scenario, one may get the implant placed, and then one may have to wait 12 weeks for that implant to integrate to the bone. Okay. So it's a 3-month integration period before you can have your crown attached. Now, there's exceptions to that rule.
Okay.
There is immediate implantation where you can have an implant placed immediately and you can have the crown attached, albeit a temporary crown, I should add.
Right.
A temporary crown attached immediately. However, that's 10% of the cases.
Okay.
That is highly operator dependent. You need a very compliant individual to be able to do that. It's not guaranteed for sure, so you can't go overseas thinking that this is going to happen, because nobody knows that's going to happen until the day. Not even the surgeon knows. So, and that brings me to another point. I mean, it's not only about having the surgery. It's about doing the planning.
Okay.
And you can't do the planning via email and over the phone. You really, when we see somebody here, we get to know them. We find out what their expectations are. We learn about their medical condition. What do they want out of the treatment? There are always several options involved. So we talk about all of those things. We look at the condition of their mouth in general. What sort of, is there gum disease present? Is there outstanding general dental work to be done? This is all relevant for the success of the dental implant. So to come up with the answers to all of these questions by email or on the phone, and to expect to land in an overseas country when you're there for 2 weeks to get everything done, including the implant placed, it just doesn't work that way, Jess, to be honest.
And I guess the fact that this period takes you, as you mentioned, up to 3 months. What, I mean, with going overseas for this type of work, would that mean that someone would have to go over there, come back, or stay over there for that time? I mean, you know.
Look, for a single tooth implant, one would have to do that to do things properly. They to place a crown straight away or a bridge straight away on an implant. Once again, it can be done, but it's certainly not mainstream, and it's case specific. And I've had failures like that, to be quite honest.
What are some of the, I guess, complications that you've seen from?
Look, there are biological complications. The worst thing that can happen is the implant can fail to integrate to your bone.
Okay, so what does that mean?
That basically means this screw. So the way a dental implant works is the bone grows right up against the implant, and that makes it strong, and that's why we're waiting 12 weeks for the bone to grow. And then the crown is attached. However, if something happens and the bone doesn't grow, so that could mean infection, that could mean poor patient compliance, that could be medical issues that the patient may have in terms of their bone metabolism or whatever, and that could lead to failure of the bone to grow and loss of the implant, and the implant's loose basically. So that means that the implant then has to be removed. If that happens, there's two options. One option would be to do it again, or another option would be to seek an alternative replacement option.
Right. Yeah, because, I mean, again, just considering the costs as, from a consumer point of view, I just wonder, with all of those things, insurance, how does, travel insurance come into play with that? And I guess, are these practitioners overseas, what happens if there is a complication of someone's return back to Australia?
They're all good questions, and I think that that's the inherent risk here. That's the problem.
So that's what people need to really consider.
Yeah, but my concern is, Jess, not only the fact that the implant may fail. I would personally be worried about having a surgical procedure done overseas. I'm not into scaremongering, and once again, I'm not trying to say that the quality of care overseas is any less. But I have a colleague who's a haematologist, and somebody has acquired HIV overseas from having a procedure done overseas. So it's the safety factor that concerns me. The standards. There have been situations in Australia where there have been infection control breaches, and there have been and Queensland Health has been on top of that, you know. So, that will be my concern. Not only in relation to the implant specifically, but just generally. Is it a safe thing to do? And there's no protection should something go wrong.
Okay.
Yeah.
So, what are some ways that people can save on dental implant treatment?
Look, unfortunately, dental implant treatment is costly, and I understand that. This expense is a relative term, expensive, but it's a lot of money for a lot of people. But I think that the first thing that I would say would be to look at all of the options in full. I mean, you don't necessarily need the Rolls-Royce option. So within dental implant treatment, there are often a spectrum of different potential possibilities. And I think that you don't necessarily need the full bang, most complex form of treatment.
Right.
Also, the more complex something is, the more that can go wrong. So I would say if you're seeing somebody that's suitably qualified and experienced, they can give you their advice on how to keep it simple and minimalistic, but yet still achieving your desired result.
Okay.
Yeah.
And so what would you say, in your professional opinion, how can someone tell if, you know, the materials are good quality versus bad quality? How can someone
from a dental point of view? Yeah. That's a good question. You do get different implant companies. You get European-made implants, and then you get implants made elsewhere, and then different alloys, and you get implants that are commercially pure titanium. I mean, most implants are titanium, and that's how they work, because titanium is a very biocompatible material. So you get alloys, which are titanium with other materials added to that. So you don't quite know how safe and compatible that is with the body. But more of a concern to me is the bone grafting material being used.
Okay.
I have several patients that have had this treatment done overseas, and they were told that they use human cadaver bone for their grafting cases. So it's just how safe is that? Where is the source of that material? And so what's
typically used for here in Australia?
For bone graft? 90% of the bone grafting material in Australia is a bovine bone origin. There are some synthetic substitutes, but most of the research has been done with a product called BioOS, which is a bovine bone material, and that is the most common material that Australian dentists tend to use.
Okay, right.
Yeah.
Excellent. And so what are the steps someone can take, whether they're looking overseas for dental implant treatment or here in Australia? You know, what would be the standard protocol that someone would have to go to, for example, if someone were to come and see you at your clinic?
Sure. I guess this is a complex form of treatment, and I think that the first thing as a clinician for me is I want to get to know that person. I want to know what they want to get out of this treatment, what their reasoning for doing this is. Is it an aesthetic thing? Is it a functional thing? Are they able to chew okay? Are they generally healthy? Do they have any medical conditions that need to be taken into account? So I guess it's just getting to know a little bit about them, a little bit about their dental history. Are they nervous patient? Are they apprehensive? There's always a degree of apprehension because this is surgery. And by the way, I don't know if you know, but I have a dental implant.
Oh, really?
Yes. I've been on the receiving end as well, so I know what it's like to be a patient. So I know that, you know, if there's somebody doing surgery on me, I also get a bit nervous, and that's normal. So I guess I'd want to get to know the person that's doing surgery on me. But we would just basically have an introduction, basically, like a first consultation, really. And we'll, at that point in time, we do talk about some general costs involved, and we talk about the process involved, we talk about the time involved in having.
Because you really don't know before going to speak to a professional. You know, it all varies, doesn't it?
Look, it does vary, and
Yeah.
I think it's important to have a good information gathering appointment, so that you can get a bit of a lowdown about what's involved, right? And not only the good but the bad as well. About what can potentially go wrong, and that's important to talk about that.
Yeah.
And I guess from that appointment, if one is interested to do this, then the second step would be to arrange some form of imaging.
Okay.
Be it two-dimensional X-rays, or these days what's becoming more commonplace are cone beam imaging, which are three-dimensional images, which give us an appreciation of the bone volume. And from that we can see whether there is enough bone to receive a dental implant, and if there is not enough bone, how are we going to manage that?
And so what does someone have to ensure before they go ahead at looking, at this kind of treatment? Because I've also heard that, the health of your gums and mouth also determine whether you're a suitable candidate for dental implants.
Look, there's many factors that come into it, and that's a good point, because the point you raise is, I guess, gingivitis and plaque. There are bacteria that create gingivitis in one's mouth in the form of plaque, and the same bacteria can lead to problems with the implant. In the worst case scenario, it can lead to something called peri-implantitis, which is bone loss around the implant, which, like that image I was showing you before.
Yes,
with the bone.
So, Vahan, you were showing me some of these images beforehand.
Right.
What am I looking at here?
These are some of the cases that I've had, and it's becoming more and more commonplace. This is this first image here is actually showing bone loss around an implant. So this is basically gum disease that can occur around the implant. So infection can set in around the implant, and that's why when you have an implant made, it should be checked annually. So you still need a relationship with the local dentist, even if you have this treatment done overseas.
Yeah, right.
It's not just get it done and right, you're sorted now. It's just like natural teeth. They need to be cleaned, they need to be maintained. So regular X-rays may be necessary to check for the presence of disease. This first image actually shows the presence of disease around one of the implants. Okay. The second image here shows an implant crown and the abutment screw, and that in this situation the crown was cemented onto the abutment, which is then screwed into the implant. I know that's complex, but it basically shows excess cement, which once again also leads to infection and
so is that on this thing or the little...
The cement is actually on the abutment, which is the tooth is cemented onto the abutment, and that's if that cement is not managed properly, that sort of squishes over the side and creates spinach marks. And I'm not saying, though, these things are hard to manage. So I'm not saying that an Australian dentist won't do these things. And I'm not trying to be derogatory. I'm simply saying that if any adverse outcome arises, and if you've had this treatment done in Australia, you can go back to the same person and they can manage it for you.
Right. I guess it's all about mitigating. On the off chance that something would happen, you want to be in safe hands.
Well, you know what? I would say that it's not as if something would happen. The science tells us that something is going to happen. I mean, there was a study that I read the other day from out of Adelaide that said that there's 88% chance over a certain time period that you will have some form of complication. So the bottom line is that something will happen.
And you really, I guess, want to know that someone knows how to handle when that may happen.
Herein lies the eternal challenge for an Australian dentist. Trying to figure out a solution to a problem when you weren't involved in the treatment from the outset.
I understand.
So
what would be your final recommendations for someone looking at this treatment here or overseas what would you sum it up as things to look for, things to be wary about?
Okay, look, I think, well, going back to what we were saying before, I would make sure that the rest of your mouth is healthy, because you have to make sure what you've got is healthy before you replace what you haven't got, basically.
Okay.
So I would just make sure that you're up to date with a dental checkup, and then if you're exploring that implant option, I would be guided by a suitably qualified individual. I would seek the advice from somebody that's preferably had tertiary training in dental implantology. Remember that in Australia there's no such thing as a registered specialist in dental implantology.
Okay.
There's no such specialty. But nevertheless, if you find someone that has a little bit of extra formal training in this as a discipline, that would be something I would be looking for. In addition to that, I'd be looking for somebody that has the experience in this field, and somebody that's been around for a while, I guess, somebody that's going to be around for a while. I mean, when we treat patients in our practice, we pretty much, we want to see them, we know that we're going to see them for the rest of their lives, hopefully. And I guess if you have something done in some country overseas that you don't frequent very often, that person knows that he probably won't see you again, or she probably won't see you again.
I guess there's not really, an accountability there for the longevity of
that's
your
what it is.
treatment.
It's the accountability factor here, from an individual moral point of view, and also from a legislative point of view. I mean, there are certain protections here, having this sort of treatment done here, that you simply don't have when you go overseas. So the risks are there. And personally, any form of surgical intervention, the notion of having that done overseas is something that I would not entertain that.
Okay.
But in saying that, though, I mean, all things considered, if one was to choose to go overseas, I wish ill on no one, and I hope it works out for them. And if they accept the risks and if it all goes hunky dory, that's fantastic. Good on them. But personally, I think the risks outweigh the benefits.
And the cost sounds like
the cost. It's a bit of a Clayton saving. To be honest, because all of the exercise that I've done into it just doesn't add up. When you look at airfares, multiple trips involved, that is one factor that I just can't see, to be honest, in terms of the cost. But once again, the cost does vary. So I'm probably comparing with the more expensive overseas operators in the hope that they're more reputable.
Makes sense. Well, thank you so much, Mahan. This has been really insightful, and hopefully, that's being able to help our viewers here today. So thanks so much for joining me.
Nice to be with you. Thanks, Jess. Thank you.